Our last speaker this morning is Marielle, and she is continuing on her trend of oral health. Marielle will deliver today project number 4, a dramatic talk from the Entertaining Speaker Manual. The objectives are to develop an entertaining dramatic talk about an experience or incident. Is also to include vivid imagery and characters, and she is to deliver this talk in an entertaining manner. It's 5 to 7 minutes, and the title is Cost of Care or Wealth of Health. Let's welcome Marielle.
Cost of care or wealth of health? This is my question. Maryland, January 2007. 12-year-old DeMonte driver has a toothache, but he doesn't tell his mom. She has enough worries, he thinks. No money, no insurance. She hasn't been able to find a dentist willing to see his younger brother, who's in a lot more pain than he himself is. But eventually, DeMonte's pain grows so unbearable that he has no choice but to tell his mother, who takes him to the emergency department of the local hospital. There, they give him antibiotics and analgesics and send him back home. But the pain doesn't go away. It only grows worse and worse, and eventually it's accompanied by unbearable, excruciating headaches. So his mom takes him back to the emergency room. This time, he's admitted. An MRI scan shows that he has swelling on his brain. DeMonte driver dies at the end of February after 6 weeks in hospital, 2 brain surgeries, and 1 tooth extraction under general anesthesia. The cost, $250,000. Ohio, May 2014, John Schneider, 31, dies as a result of a tooth infection in ICU, surrounded by the beeping of life support equipment. The cost of the open heart surgery that failed to save his life, $300,000. Now, you may think that stories like this are rare. After all, there's 7 years between those 2 events. But think again. Every year, nearly 13,000 people are admitted through the emergency departments of hospitals across this country because of life-threatening tooth infections. Do the math. That adds up to 245 people every week admitted with conditions similar to what killed DeMonte driver and John Schneider. They don't make the headlines because they survive. And this in itself is a tragedy. The ones who survive sometimes make it into dental journals. Like the 11-year-old boy from Timmins, Ontario, who, like DeMonte driver, required 2 brain surgeries and is still in rehab today, 2 years after the incident. He will never grow to his full potential because of a hole in a baby tooth. And at what cost? Not just monetary, but to himself and to his whole family. Between 2000 and 2008, there were 66 documented deaths related to tooth infections. That's a small number, you will say. But the reality is these deaths are often underreported when the cause of death is tagged to thrombosis, brain empyema, endocarditis, pericarditis, blocked airways. And the dialogues around these deaths have long been around access to and the cost of dental care. The Driver brothers had a primary care doctor, a pediatrician who looked after their childhood illnesses, who provided immunizations, and whom, when they looked in their mouth, only saw their tonsils. They didn't have a primary care dentist, a provider who would have established their risk of developing dental disease by age 1, who would have provided their mother, Alice, with essential knowledge regarding oral health, who would have provided them with fluoride treatment and sealants, and who would have detected cavities in the earliest stage and prevented them from developing into severe dental disease. This type of preventive care was deemed to be too expensive. Now let's go back to those 66 documented deaths, and let's assume that this is a correct number. Do the math. It adds up to 8 people who, like DeMonte Driver and John Schneider, die as a result of a tooth infection. At an average cost of $275,000, this adds up to $2.2 million, accounting for very expensive funerals every year. Yes, care is very expensive. And when it comes too late, it also fails miserably. The prevention that was deemed to be too expensive would have saved DeMonte Driver's life. The prevention that was deemed to be too expensive would have been but a very modest investment into the wealth of health. DeMonte Driver would be celebrating his 20th birthday next year. John Schneider would still be alive. And the little boy from Timmins, Ontario, would not be struggling today at age 13 to relearn his alphabet. Cost of care or wealth of health? Where do you want to go today from here with the debates surrounding health and its care?